Hello friends, I am going to read an editorial. Prison outbreak. India's overcrowded jails pose a serious health risk to inmates. The public health crisis in India's prisons is distinguished by its poorer infrastructure and a general disregard for treating ailments until they become inconvenient. A prisoner does not lose the right to health, a point courts have repeatedly stressed. Yet, between 20 August 2025 and 9th March 2026, around 92 inmates at the Jalpaiguri Central Correctional Home were infected with herpes simplex virus, and 7 of them died. HSV is common in the general population, but experts have said that in immunocompromised or overcrowded populations with poor care, it can lead to encephalitis, which is often fatal. The home's 171% occupancy rate rendered good hygiene and isolation a luxury. According to the 2023 Prison Statistics of India, district prisons in West Bengal have reported occupancy rates exceeding 160%, and certain facilities such as the Kandi sub-jail have historically reached staggering levels of over 400%. While the state has many foreign national inmates, overcrowding is a persistent fact of India's correctional facilities. In 2023, 30% of inmates in 10 prisons in Kerala were found to have skin diseases caused by humidity and lack of personal space. A 2023 study in the Lancet Public Health found prisoners in India 5 times more likely to develop tuberculosis than the general population. In 2025, the Home Ministry ordered prison screening camps as unventilated environments allowed TB to spread rapidly. The Nagpur and Indore central jails had major COVID-19 outbreaks. According to the India Justice Report 2025, HIV prevalence among inmates is also significantly higher than the national average due to shared equipment and inadequate screening at entry. Mandatory comprehensive medical screening could catch many of these infections before they become injurious, which also requires facilities to have the requisite personnel. But the report also flagged a 43% vacancy rate for medical officers, resulting in the number of inmates per doctor being 2.6 times higher than recommended by the Model Prison Manual. There are also only 25 psychologists for India's 5.7 lakh inmates. Filling this gap requires integrating prisons into the National Health Mission, ensuring a sufficient number of health workers trained to manage outbreaks, and enforcing the manual standards uniformly across states. As West Bengal's actions in 2020 illustrate, temporarily releasing thousands of under trials to relieve overcrowding in the South 24 Parganas District Correctional Home and the Baraipur Central Jail. The solutions are not confined to health. The judiciary must fast-track cases involving under trials, who constitute the majority of inmates, expand the use of bail and non-custodial alternatives for minor offences, and expedite the repatriation of foreign nationals. Thank you for listening.